RP, First Coast, and you are live with Let's Do Lunch. And I have with us today, as always, my partner.
This is Linda Levin. I'm CEO of Elder Source, the area agency on aging and the Aging and Disability Resource Center for Northeast Florida. Welcome.
Thank you. We are so glad to have you here live on Facebook with us. And so for the last 5 months, AARP and Elder Source has shown up at this very place to do a live show, a virtual event to help bring you experts in a variety of fields. And then by last 5 months, we have had someone from Shine to talk about how to protect you and Medicare from scams. We've had someone from the art community talking about how to provide joy in your life utilizing art. Early on, we had someone also talk to us about protecting the 50 plus vote, also protecting and being counted in your decade. And so as you can see, we want to continue to show up with experts in a variety of topics. And so today is no different. Today we have with us Dr. Pauline Rolle. She is the medical executive director with Florida Department of Health here in Duval County. Welcome, Dr. Rolle.
Thank you. It is my pleasure to be here today.
We are so glad to have you.
You know that a lot of seniors, a lot of people in the public have questions about the vaccine, concerns, not knowing what to believe, what not to believe, and how to get the vaccine. So, we're so eager to hear from you today.
You are right, Linda. So what we're going to do, we're going to jump right in because we don't have a whole lot of time because our time will go very quickly. So my first question for Dr. Rolle is, so Dr. Rolle, you're hearing a lot of older adults say, I don't have internet or I don't have access. What can I do to get registered for the vaccine?
And so that's certainly been an issue throughout this pandemic, access to information, particularly for those who don't have access to computers or smartphones and things of that nature. And so certainly one of the ways you can get information is always through your primary care provider. They are your closest source. They are partners with you in your care and can certainly provide you information. The other source would, of course, be your local Department of Health. And so we're readily available to answer any questions you have. And, we have a call center here locally where we answer questions all day, every day, Monday through Friday, 8 to 5, really. And that number I will provide to you, but it's 904-253-1850. That is our local call center number. But of course, the health department is always available to assist in any way you need us to. And we are your resource for public health.
Right. Dr. Rolle, what if someone doesn't have a computer? Is the phone number the best way to make that appointment, or like you said, call the primary care?
So in terms of appointments for vaccines, there is an 800 number that folks can call. So of course, when we first rolled this out, there was a lot of difficulty in terms of folks getting appointments. We only had appointments available through our online website initially. And so it made it difficult, certainly, for those people who did not have computer access to get the vaccine. But you're in luck. We now have an 800 number that the state has put together that people can call and make an appointment. And that number is at the bottom of your screen, 866-200-3762. People can call that number and make an appointment to get the vaccine. Now, those appointments are scheduled at Regency Square Mall. And so that will be the place where you will go to get those vaccines. But that site is available 7 days a week, and it is accessible to everyone. So call that number to get the appointment, 866-200-3762. But if I could just say this also, when you call that number, you'll leave a voicemail, you'll leave a message, you'll answer a series of prompts, and someone will call you back to schedule your appointment. A lot of folks have been thinking when they get that call back that it's a scam, and certainly we don't want you to be scammed. But what they're doing is they're calling you back to get the pertinent information needed to make an appointment. And so they should identify themselves as being affiliated with us and be able to provide you pertinent information so that you're comfortable in making your appointment with that program.
Well, That's very good to know. Thank you for letting us know that. Some folks we've been hearing from are worried about getting the vaccine. How effective is it? Is it effective? Are there risks? What are the risks? Can you share some of that information?
So I certainly understand people have a fair amount of skepticism. Public health and medicine haven't always been kind to the public, and so we certainly understand that. But this vaccine, the benefits outweigh the risk. Um, During the clinical trials that were done with each of the vaccines that are currently readily available, Pfizer and Moderna, they had almost a 95%. Now, understand what that means. Efficacy relates to when it's in a controlled environment, a research environment. Now, the effectiveness will be determined as we get more people vaccinated in the community, but we expect that it will approach 95%, meaning that if we get 100 people who get the vaccine, we expect that at least 95 of those will get sufficient protection against the virus. With any vaccine, there is no vaccine on the market that's 100% effective, but these vaccines have been deemed efficacious enough in clinical trials to be equally effective in the community. And so I know folks have a lot of concerns because it's new and all of that. And so I want to say, it doesn't alter your DNA. It's not known to do that. This is a messenger RNA vaccine. And there are other vaccines coming on the market that use different technologies. So understand that. If you're uncomfortable with these vaccines, certainly we expect that others will come online. But again, the benefits outweigh the risk. People are still dying from COVID. People are getting very ill and having adverse outcomes as a result. And so we want to try and prevent that.
Thank you so much, Dr. Rose. So now you can see why it is so crucial to have her on to answer your questions. So, Dr. Rose, this vaccine rolled out very, very quickly. And so people are asking, is it safe because it rolled out so quickly? And is part of the reason why it was able to roll out very quickly was because of the participation with the world and some other world organizations.
So yes, all across the world, there were a number of companies across the country that were working on this very thing, this vaccine. Also, mRNA technology is not totally new to us. It's been used in other arenas. It may be new on the vaccine front to some extent, but it has been used in other arenas. And so, again, I understand people's skepticism. You should question, you should ask. Certainly, how safe it is. That is an appropriate question. But it has been studied and it has been studied across the world, and a number of partners came together to ensure the safety of it before it came to market. And so these vaccines are deemed to be safe. They have been approved by the FDA for emergency use at this point, and so they are deemed to be safe.
Wonderful. Linda.
Vaccinated, they think that they're safe, right? And so is it safe for them to stop wearing the masks, or do you encourage people to continue wearing the masks?
It is absolutely not safe. So here's the deal. Let's qualify that, okay? So people are being asked to still wear their mask even after they get the vaccine. Understand this. In order to really get good coverage in the community, we need 95% of folks to get vaccinated. We're nowhere near that. And so it is going to still be important for you to wear your mask. And remember, if you've only had one dose, you are only about halfway there. And so there's always a chance that you could still get infected. But we're asking people to wear their mask, social distance. Again, think about it. Not everyone around you is going to be vaccinated. And so you want to ensure that the disease doesn't continue to propagate when it doesn't need it, by putting prevention measures in place. And so the other concern is, and I've read in some papers that the other concern is that you may be protected against the virus. However, if you are somehow harboring the virus and it may not be at the level where it affects you, it could be potentially spread to others. And so while you may get protection from the vaccine, it remains to see whether or not the vaccine will prevent you from potentially spreading the virus to others if somehow you have harboring the vaccine, the virus.
I
So
also
you have to still take those precautions.
I also understand that for other people, even though you've been vaccinated and you've gotten both shots and you may think you're safe and you're protected, that other people don't know that you've had the vaccine, right? So keeping your mask on lets them know you still care about their safety because there's no way of knowing until enough people have been vaccinated, right?
Right, true. And again, after that first dose, you're only about halfway there. And so, what we don't want people to do is feel like they're superheroes. I've gotten one dose, great, I can go out and do what I want to do. We're not quite there yet. And it's going to take a humongous effort on the part of our society to get there. And so, and again, we're now in the real world phase of looking at these vaccines. How do they respond in the real world? Again, they were on clinical trials and they were deemed to be safe. They were efficacious in a real world, in a clinical trial setting. But now we're in a real world setting where people do all kinds of things. They don't often adhere to advice. They go on and live their lives and do whatever. And so each of us may have a different response to the vaccine. That's the other important piece. While someone may get the full benefit, depending on your immune system, you may not mount the appropriate response. And so we're trying to figure that out still. And we're not 100% sure that everyone will mount the same immune response to this vaccine. And so another reason to wear the mask.
Same thing with social distancing, right? We should still
Yes,
practice social distancing.
yes, and washing of hands or using hand sanitizer, all very important.
And I just say we cannot say that enough. And so we don't want to be premature. We want to continue the efforts to keep going. So here's my next question, Dr. Rowe. So is there a government mandate to get one of the vaccines?
There is not a government mandate. And so these vaccines are perfectly voluntary. There is no mandate. A lot of folks were really concerned about it being mandatory in the beginning. We had people coming to us trying to get these exemptions because they said they didn't want the government forcing them to get the vaccine. And the government is not doing that. This is totally voluntary. We want you to just make the decision for yourself. Getting this vaccine is a very personal decision. While there may be some employers that are requiring it, we don't have any control over that, but certainly the federal government, nor the state or the local government are requiring people to get the vaccine. And then you're muted.
I have to remember to unmute myself. We're still getting used to the technology, right? So, is there anything, Dr. Roll, that you would give in the way of advice to an older adult in terms of getting the vaccine? Um, I know there's concerns about running out of the vaccine. They may have gotten the one dose, but they're not. They have to still get the second dose. Is that going to be available?
Yes, and so if you got the first dose, we are being shipped equivalent amount of vaccine to be able to provide that second dose. And so, yes, there have been supply chain issues. Not going to lie. Some of this is contingent on how fast the manufacturers can get it out the door. The other part is we're beholden to the federal government in terms of the release of those vaccines into the states. And so, while the state of Florida is working very hard to get shots in arms, as we say, the supply chain has become a bit of an issue, and so the influx of vaccines has slowed down a bit. But we expect that to pick up in the next few weeks as the manufacturers start to ramp up, and also as other manufacturers come online. And so, if you got your first shot, yes, we're getting a commensurate amount of vaccines to give you that second dose. And again, very personal decision. If you have any concerns about your health, about whether or not you should get the vaccine, you should certainly talk to your primary care provider or specialist related to your own health concerns. There are very few reasons why someone cannot get the shot. Most people can. But if you have specific medical concerns, you should certainly consult with your medical provider.
Great. What if we have a question from one of the viewers? If you are positive for the virus, can you still get the vaccine?
So, yes, people who have been positive for the virus are still recommended to get the vaccine. You do need to wait till you're out of your quarantine period. And so we don't want you coming out during your quarantine. We want to make sure you're clear. And so once you're beyond your quarantine period, you can certainly get the vaccine. And people say, well, why do I need it if I've already had COVID? Here's the deal. What we know about COVID thus far, it appears that maybe the antibodies that you develop may only last for about 90 days. I saw a study recently that indicated maybe 8 months. Not so sure about that. I need to see additional studies related to that. But for sure, we believe you have enough antibodies to protect you against COVID for at least the first 90 days after you've been infected. And so with the vaccine, we believe your coverage will be a lot longer, that you'll be protected against the virus. So here's the reason why we're asking you to get the vaccine.
Okay.
So, another question from our audience. So here's kind of a scenario, and if you could just clarify, that'd be helpful. This says, I have a small group family event coming up. A couple of people will have been vaccinated. I am not. Should I still go?
So we're still discouraging family group gatherings, whether you're vaccinated or not. So here's the deal. Again, everyone's immune system responds differently. So we would hope that if they've gotten both doses, they've gotten the maximum protection. Two, we're still not encouraging folks to gather in groups. It's just not a good idea at this point. The cases are still going up in our community. And so we ask that you not get together in groups. And if you just got to get together, we understand funerals are happening, events are happening. People are trying to get on with their lives. Socially distance outside, no more than 10 people. Those types of measures sometimes help, but are not the end all to be all. And so I would ask you to maybe rethink that a bit. I think about how, whether or not we really need to do this at this time, regardless of whether you're vaccinated or not.
Dr. Roll, can you talk a little bit more about the side effects again so people know how to prepare? And I don't know, but I've heard that the side effects may be worse with the second shot. Is that true?
And so that's what everybody was saying in the beginning. But I can tell you, I got my second shot yesterday and I'm at work. Look at me. With the first shot, I didn't have anything, no, not even soreness in the arm. With the second shot, I am a little bit sore today, but other than that, I'm fine. And so it depends. There are some people who've gotten really ill after the first shot, or really ill, particularly after the second shot. I think it really depends. It depends on the person. Most common side effects, though, redness at the site, itching, swelling at the site. Like I did have a knot, which I didn't notice really till a week after I got the vaccine. Those are the most common things. Those happen with almost every vaccine. But there are those folks who might be severely allergic to components of the vaccine. And so you need to know whether or not you have allergies to components of the vaccine. The other thing is there was some concern about those who have a history of severe allergic reaction, meaning anaphylaxis, they've been in the hospital, not being able to breathe, severe allergic reaction to certain injectable medications. There has been some concern around that. Now it's more of a precaution. I can tell you I'm one of those people. I carry an EpiPen. And so I made sure when I got my vaccine, I told folks, I carry EpiPen, you need to watch me. This is what and so at every site, there are medical personnel that observe you for 15 minutes after you get the vaccine if you've never had any untoward reactions, or 30 minutes if you're somebody like me, you have to be watched for 30 minutes. And so, but I did make sure I talked, even though I'm a doctor, I made sure I reached out to my doctor because I didn't want to be a fool about this. You're your own worst patient. And so, that's always a concern for folks, but it's typically the common side effects. Some people say they have flu-like symptoms. That's the other complaint that folks have had about the vaccine. And so that certainly does happen. But almost everybody I know, he's done fine. You may have had, I know one person who had fever and chills, and they felt really crappy right afterwards. But in less than 24 hours, they were fine.
Okay, we have a question from Mike. It says, what is the ingredients of the vaccine to know if you are allergic?
Okay, very good. Thank you for
Good
that
question, isn't it?
Yes, it's a great question. And so the most common ingredient that a lot of people will have issues with is a polyethylene glycol. That's the one that they're saying that most people will have allergic reaction to. But there are other components of the vaccine. There are lipids in the vaccine, which is a fat. There are sugars in the vaccine. But that will be the most common thing. And so again, most people will be fine. But if I always encourage folks to talk with a medical professional or give us a call. Like everybody doesn't have a primary. I get that. So we're available if you need us. And again, that number is 904-253-1850. And I'll provide that to you guys at the end of the show. Again, 904-253-1850 if you have any concerns. Because I can tell you, in some cases, the physicians are saying call the health department before you get that shot.
So, Dr. Roll, are the locations where they're giving the vaccine prepared for those allergic reactions, or do people need to come prepared?
No, they are prepared, but if you carry EpiPen, carry EpiPen. But they are prepared to address those concerns.
We have another question. If people have pre-existing conditions, are there pre-existing conditions that will keep you from taking the vaccine, or how will a person know if they should or should not take the vaccine?
So, in terms of pre-existing conditions, there's a window for those who are on chemotherapy or immunosuppressants. There's a window in which they would need to be vaccinated, and that should be done in conjunction with their medical provider that can provide them guidance on when that window is. And we've had a number of calls related to that, and I've had a number of conversations with folks who are on immunosuppressants or having other diseases where they take certain meds at certain times, or they have chemotherapy appointments and things of that nature. And so the concern becomes is if you're immunocompromised in any way, particularly like if you're a cancer patient or something like that, will you mount the appropriate immune response if given the vaccine? It's not that we're concerned the vaccine is going to harm you. It's more so the fact, is it going to benefit you? And so there are windows of time in which they're recommended to get the vaccine. So we ask people to talk with their doctor who's providing that care to understand that. But for most folks, the most common question we get is, if I have HIV, can I get the vaccine? And you certainly can. That's not a contraindication. And again, most medical conditions are not a contraindication. There's a question about pregnant women, which would be this age group, but certainly if you know someone who's pregnant, there weren't a whole lot of pregnant people in studies, but nonetheless, it seemed to be safe to be able to administer that vaccine. But again, I always encourage people do things in conjunction with your medical provider, because one size does not fit all. And you may have peculiar circumstances and what have you that preclude you from doing. But there are rare instances of that.
I wonder if we could put that important phone number that Dr. Roll shared, if we could put that back up for everybody, for them to call and make their appointment. And while people look at that and jot it down, Dr. Roll, is there anything else that you could share with us?
And what I can do is maybe provide some websites where folks can actually see the information on the ingredients. We get that question a lot in terms of what's in the vaccine. CDC has on their website, they provide the list. And so I will provide that to you for you to put out to your listeners. But again, very independent choice. Benefits appear to outweigh the risk. If you think you want the vaccine, make that call, make that appointment. And certainly there's no shame in waiting if you're not quite there yet. I'm one of those medical providers that's realistic. Like, this is not, if this was measles, mumps, rubella, I would say, yes, you know what, you need to get it like today. But I understand people are a little bit concerned. They want to take it slow. Ideally, for me as a scientist, I need 95% of the community vaccinated. But I'm also realistic that everyone's not there yet. Everyone has different circumstances, and they need to consult with their medical provider to make that decision.
Would you talk a little bit about the process? So the governor, so just talk about that process if you would. That'd be helpful so folks will know what you all are working with as well.
So the manufacturers produce the vaccine, and the safety and efficacy of all that has been decided by the FDA and the CDC. And so we are getting the vaccine free of charge to provide to the community free of charge. The state does not hold the vaccine. The vaccines come directly to us when they're shipped out. People seem to think that the state office is holding a big warehouse full of vaccines and they're not trying to give it. That's not true. That's not true at all. They're not holding anything. And we've been told on the ground, whatever you get, you need to give out within a week, within 7 days of getting it. Like, don't hold on to the vaccine. We're trying to get people vaccinated. And so that's what we're doing. Right now, the governor's order specifies that those in long-term care facilities, those 65 and older, and those who are healthcare personnel who have direct patient contact are priority at this time. It's taken us a long time to get through these groups. And so people keep asking, when do you get into the essential workers? When do you get to this group? When do you get to that group? A lot of that is going to be based on supply. And again, we want to ensure that our most vulnerable population, our 65 and older, our healthcare personnel, get the vaccine if they want it. And then, the general population, we expect maybe by March, April, we'll be able to get into those groups. And maybe sooner if the floodgates of vaccines open and we're able to vaccinate a little bit faster and get to everybody faster. But that's kind of what we're working with at this point. Oh, we've been really blessed. We've gotten a good amount of vaccine coming into the city, just like we have had testing more so than in a lot of other places as well.
Dr. Roll, one of the questions, a follow-up question to the ingredients in the vaccine, do both Pfizer and Moderna have that ingredient? I think it was polyethylene glycol you mentioned. Do they both have that?
Yes, they do. They both have that.
Is there a benefit to one vaccine over the other, whether it's Moderna or Pfizer?
No, they both are about 95% efficacious. So pick which one. Pick which one you want. It's not. They both are 2-dose vaccines. Pfizer is 21 days in between each. Moderna is 28 days in between each. It's look at it.
We have another question from Facebook. It says, what if you're not 65 but have severe pulmonary problems and heart disease? What are your chances of getting the vaccine?
So we understand that those living with chronic medical conditions were prioritized by the CDC. Right now, the hospitals in our area, and I'm not sure where that person is chiming in from, but the hospitals in our area have started reaching out to their patients who fall into the categories who have chronic medical conditions that come to see them, and so they are making appointments for those groups. At the health department, we haven't. That's not part of our priorities at this juncture in terms of the executive order. But the hospitals have stepped up, and in the executive order, it gives them the authority to go ahead and start vaccinating those groups. So if your medical provider is affiliated with a hospital, or whether your primary or your specialty doc is affiliated with a hospital, you may want to reach out to their office to find out how you can get on the list.
Dr. Roll, I have another question on who's next. I know we're talking about those in long-term care, the healthcare workers who serve older adults, and then, of course, the people age 65 and older. What about family caregivers of people 65 and older, or other people who are non-medical but also work and support older adults in their home and community?
Great question.
So right now they're not including a healthcare personnel with direct patient contact. Yeah, that's one of those groups that kind of is on the border line. Kind of, they're providing that care, but they're not really medical personnel, and so they have not been included in this group.
Okay.
So you can see how important this conversation is. And Dr. Roll, we'd like to thank you very, very much for being here with us today. We'd like to thank those on Facebook and YouTube that's watching us live. Great questions. Continue to go and get your questions answered. And when the vaccine is available, we just encourage you to take full advantage of it if you're able to. And thank you again for being with us for Let's Do Lunch. We'll be here again next month for Let's Do Lunch. And please check out the resource page that we have offered you, and you can utilize that at your convenience. One more time, please, Dr. Roll, give us the number to call. One last time.
866-200-3762 to make your appointment.
Dr. Roll, thank you so much for your time today.
No
And you heard it here at Let's Do Lunch.